Thank you for watching our informational video about your mammogram. We have produced this video primarily for women who are about to have their first mammogram, so they have a better idea of what to expect. In this video, we'll cover the main reasons for having a mammogram, what to expect during your mammogram, tips to make your mammogram easier, other scans you might need to complement your mammogram, and what happens if you have breast implants. Having a mammogram can be a little daunting, especially if you aren't really sure what's happening and why. This video will demonstrate and explain a typical mammogram so you can feel comfortable with the process. There are two main types of mammograms, a screening mammogram and a diagnostic mammogram. A screening mammogram is a routine screening examination that's recommended for all women to look for signs of early breast cancer. Because we can't prevent breast cancer, early detection is the best defense. In Australia, BreastScreen encourages all women over the age of 40 to have a screening mammogram every 2 years. Eligible women can have this mammogram with a government-funded BreastScreen service for free, but some ladies choose to have this examination performed privately for a fee. A diagnostic mammogram is for women who have been referred by their doctor because they are experiencing some breast symptoms that the doctor wants to look at more closely. We do use different mammogram machines across our practices. The one used in this video is a 3D machine, which means an arm will move during your mammogram. This enables us to take images similar to a CT scan. Different practices will have different machines. When you arrive for your mammogram, you will be asked to complete a questionnaire about your breast history. Please fill this form out as accurately as possible. The more information your mammographer has about your medical history, the more accurate the diagnosis. It's also important to bring along images from any previous breast scans you may have had. There's no special preparation you need for your mammogram, but we do recommend 2 simple tips to make the process easier. Avoid wearing talcum powder, deodorant, or perfume, as traces of these can show up on your images. If you forget, we will give you wipes to remove any traces before we start. Also, wear pants or a skirt rather than a dress. We'll ask you to undress from the waist up for your mammogram, and we find women are more comfortable tucking the gown into their skirt or pants. If you wear a dress, it will be harder to tuck the gown around your waist. The more comfortable you are, the easier it is to get the positioning right for your mammogram. Once you are robed, your mammographer will then explain the entire procedure to you and do their very best to keep you comfortable. Essentially, a mammogram is a very sensitive and detailed X-ray of your breasts, but a few things often surprise our patients. Generally, both breasts are studied, even if you only have symptoms on one side. Also, your mammogram is performed standing up. We find a lot of patients aren't expecting to stand because for most other X-rays, like ultrasounds, you lie down. Finally, some women become anxious about the exam itself, as when you have the mammogram, your breast is compressed or flattened while the images are taken. This lasts for about 20 seconds per image. We routinely take 4 separate images, 2 on the left breast and 2 on the right. We then show the pictures to our radiologist, the doctor trained to read the mammogram images. The radiologist may need to examine you personally or may request more images to help see a part of the breast more clearly. This is fairly common and it doesn't mean something is wrong. Our radiologists are just being thorough. Everyone's sensitivities vary, and while many ladies agree having a mammogram is not painful, it is usually quite uncomfortable, and some women do find it painful. While the procedure may be unpleasant, it is necessary to make sure our radiologist can make the most accurate diagnosis. Your mammographer is highly trained, and they do their best to release the compression quickly, but they do have to balance your comfort with getting the best, most accurate results. If you do have breast implants, it's best we know this before your mammogram. Your mammographer will ask you when you arrive, but we prefer you notify our staff when you make your booking, as you will need a slightly longer appointment time. We usually perform a short ultrasound before your mammogram to assess the implants before we apply compression. It is perfectly safe to apply compression to implants once they have been assessed. Unfortunately, with implants, not all breast tissue can be imaged, so we may take a few extra images to make sure we can assess all the tissue. There are some further examinations which can help your doctor make their diagnosis. These may be ordered at the same time as your mammogram or as a follow-up. These include a breast MRI and a breast ultrasound. Ultrasound of the breast is almost always performed at the same time as a mammogram, usually after your scans. The ultrasound is important to support the findings of the mammogram or to provide additional information for added accuracy. An ultrasound is also particularly useful for women under the age of 35, as younger breasts are more dense, making it harder to see the tissue properly on a mammogram. There are also times when our radiologist may recommend a biopsy. In a biopsy, a needle is used to remove a sample of your breast tissue for laboratory testing. If this is needed, our radiologist will discuss this with you and your doctor before carrying out any testing. We are often asked about the costs of mammograms and if any Medicare rebates apply. If you are coming in for a screening mammogram, there are no Medicare rebates, so a private fee will apply. You may be eligible for a Medicare rebate for your diagnostic mammograms if you meet certain clinical indications. Your doctor will be aware of these and will note them on your referral form. Things like you are experiencing pain or tenderness, you have a lump, you have previously had breast cancer, or you have a family history of breast cancer. While we don't routinely bulk bill for mammograms, we may offer bulk billing concessions on some examinations for healthcare and pension card holders. Please ask our staff when booking. Rest assured that when you make an appointment, we will let you know exactly how much your scan will cost and what amount can be claimed back from Medicare. Because a mammogram is such a specialised and important scan, our priority is to ensure your health is in the best hands. Our radiologists and mammographers are specially qualified and highly experienced and use the best technology available so you can have peace of mind that your diagnosis with us will be accurate. We hope this video explained what to expect when having a mammogram. If you have any questions about your scans, please contact your nearest Queensland X-Ray practice or ask your mammographer when you arrive for your scan.